I, Bola Ahmed Tinubu.
President Bola Tinubu, on assumption of office on May 29, 2023, made the health sector one of his priority areas and appointed Professor Ali Pate as the Minister of Health and US-based nephrologist Dr. Tunji Alausa as the Minister of State for Health and Social Welfare on August 23, 2023.
Nigeria, so help me God.
Professor Pate made it clear from the moment he assumed office that a new approach is needed to address the challenges in the health sector, as he anchored his blueprint on 4 pillars. They are effective governance, improved population health outcomes, unlocking healthcare value chains, and health security. The approach birthed the Nigeria Health Sector Renewal Investment Initiative on December 12, 2023, and the signing of the Health Renewal Compact by governors of the 36 states and the FCT, which will be implemented through a sector-wide approach. To set the ball rolling, in January 2024, 1.3 trillion naira was allocated to the health sector in the 2024 budget. This represents 4.6% of the total budget. However, it falls short of the Abuja Declaration by African heads of states, which stipulates that 15% of the national budget be earmarked for the health sector. This budgetary allocation further raised concerns about meeting the healthcare needs of the nation, especially given the persistent economic realities necessitated by the removal of fuel subsidy and the impact of foreign exchange. In the primary healthcare delivery system, the administration took steps to address the challenges by moving to revive the primary healthcare facilities, recruit more health workers, and the infusion of 25 billion naira into the National Primary Healthcare Development Agency and the National Health Insurance Authority. The idea is to improve health outcomes for Nigerians.
There has to be a clearer accountability mechanism and clearer indication of where those funds are going to be used. And wherever they're going to be used, there needs to be a monitoring evaluation process and how are they performing. People need to see some of those quick wins from the current administration to gain that trust.
A big distress for Nigeria is the high burden of communicable and non-communicable diseases. The impacts of the COVID-19 pandemic and its aftermath exposed the inadequacies in Nigeria's response to infectious diseases. Hence, the call for a well-funded health security architecture.
We all know that when an outbreak happens, it's not going to happen in some mall in Abuja or Lagos. It often happens in communities. And how quickly are those communities able to respond? So, a coordinating mechanism through which the Ministries of Agriculture, Environment, and Health work collectively in this one health umbrella to ensure that our health security is protected has to be one of the focuses, I think, going forward.
Perhaps the biggest challenge in the sector is the rising rate of brain drain, which is worsening the shortage of healthcare workers and impacts the quality of healthcare available to citizens.
Until we have government officials using government hospitals, we can't solve this problem. We can't solve this problem. So when you have senators and House of Rep members and ministers come to these hospitals, for example, and pick up a card and see what the consulting rooms look like, maybe they will have a rethink. Maybe when they are wheeled to the theater and they hear that, oh, the oxygens are not working, maybe they will have a rethink. Maybe when they come to the hospital and then you wheel them to the accident emergency and there's no electricity, maybe they will have a rethink. But these men are powerful. They have access to very good doctors. So the one doctor to 10,000 patients does not apply to them.
Nevertheless, the administration prides itself on bringing some stability to the sector, particularly with the deployment of resources to primary healthcare, infrastructure, cancer treatment, amongst others.
People are coming into the country to get health care. from other sub-Saharan Africa, from India, even from Europe. You go to several hospitals in Lagos and some of our capital cities. People are coming. The cost of getting surgery is cheaper here. People are coming to get cancer care. And we're adding more cancer centers to the already existing one. The president gave approval not too long ago for us to build 6 new cancer centers, as well as add 9 diagnosis centers to all across the 6 geopolitical zones. These are in addition to what we already have. We're funding our hospital better. We're adding more equipment to our hospitals. Things are much better.
While the administration takes pride in the investments made in the health sector, Nigerians are waiting for the impact on their lives, as the government is optimistic that the plans for the health sector will meet the yearnings of the citizens. In Abuja, Victoria Longjon for Channels Television News.